right. Hi, everyone. We are back. I see everyone's stuck with us, so you must be really engaged in this Friday afternoon. It's a little blustery here in Airdrie, so perhaps it's nice to be cuddled up at home watching two lovely ladies and now two sort of lovely gentlemen follow up with the conditioning talk. So obviously we have Dr. Chad Hewlett, the founder and owner of Energy Equine. Many of you obviously will know Chad. And then Cody Calhoun, our in-house farrier of Smokin Equine. Cody's been with us working out of clinic for I think just around a year, and then we've obviously worked with him longer previous to when he came on board. So you can generally find Cody here on Mondays at the Airdrie location, but we do call him in regularly on cases as well. So today we've talked about conditioning and kind of the team approach when it comes to body work and everything. So now we're gonna pivot to something that's so important, which is the foot. Another reason that we see a lot of horses broken, and that's what we're trying to get away from today. So if you do have any questions, please put them in the chat box like you guys already did. That was awesome. And we will go through them at the end of the talk. But yeah, I'm going to turn my camera and mic off and turn it over to Cody Calhoun and Dr. Chad Hewlett.
Hey everyone, it's me and my friend Cody. So we're gonna do some talking on preventative soundness maintenance and hoof and body balance this afternoon. Just a quick note: Cody's been shoeing for how many years now?
5 years.
5 years professionally.
Yeah.
And he rides and ropes, and then he's got a barrel racer that lives in his house too. So
yeah,
I feel bad for him. Yeah. So anyway, so those are kind of the things there on that side. You grew up in like Grand Prairie?
I grew up in High Prairie. Yeah.
Yeah, High Prairie.
Yeah.
So, and went to school there, played some hockey.
Yeah, big hockey player growing up.
And then took your farrier in Oklahoma?
Yeah, went down to Oklahoma State. And then basically learned to trim horses there and did the rest on my own, I guess.
Okay, good. And Cody's been hanging around for at least the last couple of years, as Louisa said. So just want to make sure we kind of got that in there, because you may not know Cody if you don't come to get a shoe job done or whatever. Just that gives a little bit of a background so that we know where we're coming from. Oklahoma State has a really good horse shoeing program, just so you know. It's a good school. And for those that don't know me, it's 26 years in veterinary practice. Lived in Canada for most of that. Grew up in Iowa, a ranch kid, and love soundness and love shoeing too. So it's kind of fun to go through these things. And we'll just kind of start to move into it. Cody, you know how to push the buttons.
All right, so we're going to start off pretty simple here. We'll just talk about the external structures of the foot and slowly work our way into the internal and what we want to see in a trim. So starting off, we'll talk about the hoof-pastern angle. And if we can you all see my foot here? So I guess we'll turn this around. So we got the long pastern bone here, short pastern bone, and we got the coffin bone. So when we turn it around, we got our pastern angle and we got our hoof angle. I think that'll make more sense as we slowly move forward. So when you bring your horse into the clinic, we often look at the front feet for sure, and obviously the back feet, but the most problems happen in the front feet. So there's 3 different types of pastern angles. We got the balanced, which is A, the broken forward, which is B, and you often see a lot of club-footed horses like that. And we have C, the broken back.
Would you say, I mean, we're going to get into this a little bit more, and we're going to talk about some radiographs and go through some cases, like kind of just talk some case discussions. I would say in our practice and in your practice too, Cody, do you think you see probably more like C?
Yeah,
anything
for
else?
sure.
Like, I mean, we definitely see quite a few A's too. There's quite a few horses with decent pastern angles. I mean, it's not a terrible problem all the time. But and the club-footed ones, you know, every horse kind of has a high heel, low heel. So you'll tend to see one of those feet that'll tend to be more, I don't want to say broken forward, but it could go that way.
Yeah.
But that C is the one that we're going to see a lot.
Yeah, we often see a lot of sore-heeled horses and a lot of bruised toes. So navicular is a big thing I find in our practice today.
Yeah, we'll go through those as we go through the talk.
Okay. All right, we'll move forward. So when we see a balanced foot, this is optimal when a horse walks in, and we want to see a nice heel landing. We want to really activate that frog in the backside of the foot. as we all know, the frog is the heart of the foot, so it disperses the blood throughout the foot and back up the leg as well. So when we also want to see a shorter break over on the foot, we don't want that toe out there real long. We want a nice, when we see a foot, we want the angle of the front of the hoof to be the same as the back of the hoof. Oh, let you hold that.
Let me hold.
There we go. So we want these two angles here to be roughly the same. That way we're not running forward. What happens when we have a nice short toe, a nice solid frog pressure, is we get a lot of solar protection. So what that means, if we take this off, and we can all see our coffin bone here, solar protection would be the distance between the sole and the coffin bone. So when we have a nice balanced frog pressure, short toe, we tend to see deeper soles.
Which gives us a little bit more cushion throughout the whole body, right? I mean, the ligaments and the tendons are going to take a lot of that pressure off as we go through, but if we've got that nice concussion absorbing sole, it's nice to see from these standpoints. These horses then tend to be more balanced on their foot, and they're not trying to move around and land, you know, I don't want to say awkward, but let's say unbalanced positions that we talk about. Okay.
All righty, we'll move forward. So now we got the broken forward. So if we were to take this, and we see them in club feet, obviously, but this would be, you know, what the internal structures look like. So what happens in a club foot is our toes generally hit the ground first. So we'll often see a big bruised toe, often a lot of abscessing coming out of that toe. And so what causes these club feet is that DDFT as a baby is often stretched because the bones grow faster than the ligaments do. So it often pulls that coffin bone down and creates suspensory problems. And I'll let Chad talk to you about all that.
Yeah. A couple other things too, I just want to add in, especially if you have draft horses or warm bloods, taller breeds, even thoroughbreds. Quarter horses, we see this too, but I mean, we look at this club-footed, which is a really nice example, and it's pretty extreme, right? Like it's got a really nice box and it's big. But even on a lot of horses, we're talking about that long heel, short heel, tall heel sort of thing. Even on those horses, we believe, okay, and it's a little hard with the screen here, but I'm gonna try and stick my arm out. When we think about babies eating, they tend to be left-handed or right-handed, right? So when we see that, we believe that that lower heel is the one that goes forward, and that higher heel is the one that they tend to drop and eat. And because it's no different than you and I being handed, those horses will do that. So I think that's a thing that we want to keep in mind is pretty much every horse that Kody would trim, or your horse your trims, or the horses that you have, you're going to have a tendency for that. Like they're never going to be perfectly identical, right? Would you agree? Like, I mean, it's not that they're going to have that club, but I think what we're trying to get at is like managing those two different feet, right? One's a little more on that low heel, or maybe it's the ideal. The other one's maybe the ideal, or a little bit of a broken forward, right? Hopefully I'm saying all these things right. Sometimes this afternoon, I couldn't remember the fibula. I kept calling it the ulna in the horse. So sometimes that happens where we just kind of get crossed up. So anyway, I want to make sure we go through those things, because that pretty much chalks up every single horse. Even on the quarter horses and the Arabs where you wouldn't know that, you're still seeing that happen when we look at it real subtly, right? So you kind of get into those things where we want to be able to manage that pretty much in every horse. Bruised toe, stress, DDFT. You know, we talk about the deep digital flexor tendon and development, like Kody said. It's not so much the tendons giving us grief, it's that we've got bones that grew too fast, or we've got a foal that was really extreme with the eating, and through that went through a growth spurt. Then we end up with that kind of tipped coffin bone that Kody was showing. And it tends to be a thing that we need to manage, right? Having a broken hoof-pastern angle in your horse isn't a dope fly zone, or a zone where we're like, oh, this is terrible. It's more of a, hey, if I've got this going on, I'm just going to have to deal with it, right? And I think that's what this talk was about, is that this is one of those really solid things that every single horse, you're going to deal with this. Like whether it's a small-footed horse or a large-footed horse, pie-plated, navicular, like it doesn't really matter. This HPA is every single time that we look a foot, we're going to be managing that.
Yeah, I think it's important that, as a baby, we're able to fix those club-footed. We obviously have to do surgery on them, but as the horse gets older, we just manage the foot properly, and we take a lot of x-rays and work together, and we usually have a sound horse at the end, but it does take a little more work than a regular foot.
Yeah. Okay, we'll go into the next section too. Is that right? Yeah, broken back.
So now we'll talk about the broken back. So this is something we see every day. I mean, this is 99% of my work, is trying to collect a foot back underneath of itself and relieve the stress on the DDFT. It's a little bit different stress from the broken forward. Now we have the coffin bone that is actually lower at the back than the front. So now we have constant stress on the DDFT, which is and then putting pressure on this little bone right here behind the P2, which is called the navicular bone. So oftentimes, when we watch horses walk, those horses now have, because their toe is so long, they have a toe first landing. And what happens when the toe hits is the heels are in concussion. So we often see sore heels,
crushed heels.
Yeah. So when we put the hoof testers on them, it's pretty reactive in the back half of the foot usually. And
as Cody stated again, let's just kind of come back to if we think of the development of our horses, like this foot's forward, this is probably going to be the lower one, just based on the fact that that heel isn't so stretched as the back foot is. It also tends to be, it seems like genetically we've selected for these kinds of horses. Now, that's a real long statement for me to make, but I believe, like Cody and I were talking about, I think we see, and I would say with most of my horseshoers, that's a daily thing that we're dealing with, is these negative hoof-pastern or negative plantar, negative palmar. So palmar is the front foot, plantar is the hind foot. The negative angles or the flat angles are a pretty typical thing we're dealing with. And then just being able to manage these horses. Foot growth changes quite a bit with horses over time. We wonder if some of it's not human created too, from a standpoint of trimming and desired outcomes for certain kinds of horses and how people want them to go. I'd say over the last 10 years, though, the education has come along really nicely in the industry to where we're trying to manage our way away from this as much as we can.
Yeah, I think, like we live in Alberta, it's such a wet climate in this province that our horses are constantly standing in water. So they're so easily manipulated by pressure. And 90 or 60 to 70% of the weight in our horses in our front end. Mm-hmm. So it's a lot of strain in the front half of the body of the horse.
Yeah, good. So I think that kind of gives us the gist of that. Cody, we talked about at the bottom, there's going to be these tend to be more heel sore or sore in the back of their foot. Coffin joints are common for us to look at. Frogs are sore. Navicular bones sore.
Yeah, I think navicular is kind of a widespread word. We try and, before we, x-ray the horse or what have you, we try and say sore heels. Try not to run to navicular. People kind of get scared away from that word oftentimes. So until it's a for sure answer, we try and use sore heels or.
Good. I'm just going to do one more quick little example here. So if we look at the bottom where the navicular bone is, and I think Cody alluded to this before, the more this angle changes this way, if you look where my little finger is, the more likely those horses are to be putting pressure through the sling, right? So the sling would be the deep digital flexor tendon that runs along here and hooks on the bottom and the navicular bone, versus jamming it into this nice carriage, right, that we have here that nature's already set up for. And I think that's a lot of the stuff that we end up medically dealing with is around that apparatus. It's not all the problems, but I'd say it's a significant portion.
For sure. All righty. So now we're going to move on to the next topic here. We'll talk about heel support. And in that topic, we'll talk about more into the bony column of the foot, how we'd like the foot to be trimmed and the importance of that trim. And when we have our run forward feet, how to create a false heel for that foot to bring the body back underneath of itself, if that makes sense. So just like the HPA, the bony column has 3 different axes. We have the broken forward, our club foot. We have a broken back, or we call them the negative palmar angle. And we have our normal or straight axis. So we'll start off with the straight one. As you guys can see, the red line indicates right from the top of P1 to the middle of that P3 bone, we got a nice straight line. We want to see nice even joints, in our bony column. What happens when they start to get out of alignment is we often see a lot of extra bony growth. We also want to see a correct center of rotation. So center of the rotation, we're going to go from right in the middle of P2, and we're going to drop a vertical line down to the middle of the foot. That line there should end up at the widest part of the foot in a properly trimmed foot. So another thing, so when we talk about strong heel base, when we have a nicely aligned foot, we got that nice frog pressure. This number 9 here, that's our digital cushion. So it's no different than the shocks on a vehicle. We want all of our weight to bear in the widest part of that foot, and that'll help bring blood flow throughout the foot and body.
I'm going to add in 2 things. Can you give me that longer like their code? So I'm going to try to back up just a little bit here. Hopefully you guys get a bit of an idea. So we're going to add in the 2 parts of the bony column. One is that lower part that we talked about, which relates back to our HPA. Okay, so the other part, if I can get this code and take your measurement here. Let's just take a little look. And if I put this tape measure onto this bony column as it extends up, right? So let's just think of this. We have the part that Code talked about underneath, and then we have the whole column as it runs up the leg. Okay, so this is a knee on the front. You can see I got my knee joint here. So we're going to want to make sure that that bony column, when it drives down this part, is driving down into at least the back of the foot. One of the things we run into quite a bit if we're not careful is we end up with, I'm going to try to make this false look, but if it drifts out to where I'm not touching, and now if you thought about that pressure coming through the ruler, okay, if it's coming through, I'm actually missing the foot. Does that make sense? Like I'm not actually driving, the bony column is driving into almost into air, right? I really want it to drive into my shoe or the heel at some point. I'd like that bony column to be driving in here. This gives me the support that I want. And that's going to bring us into this strong heel and that conversation around sometimes we have to do some, I don't know if I like the word false, but heel support or manipulation of that bottom triangle that Code talked about at the beginning. Okay, so there's 2 different bony columns that we're going to go through.
Now we talked about the broken back axis here. So that's our negative palmar and negative plantar angle. What usually happens when our toe is driven into the ground first, it stretches the toe and the heels both very forward. And like Chad was showing you with the ruler and the other front leg, is the heels start to migrate forward. I think on this one here, hopefully you guys can all see this black line. It's not very vertically. So it almost wants to move towards the toe of the foot. And that's where we often get those feet that don't follow our vertical line back up the body. So we got to try and relieve the toe pressure and bring the foot back underneath of itself.
What do we got on here? So broken back, stress, DDFT, damaged navicular, and then coffin joint. Code talked a little bit about that, but just think about those angles that you see on the screen there. We tend to find that, I think I talked about this previously with the model, was kind of trying to point into these different areas. But if you look at that, what color is this line here, Cody?
Yellow.
Yellow. Those people that don't know, I might be colorblind, so every line looks a little different than it does for you guys. But the yellow one that's going into that coffin joint, if we look at it, that's out of balance, right? Like it should be more into the cradle, into that coffin joint, so it's cradled more versus driving into that navicular bone and into the bottom. Of those horses definitely have inflammation in those two areas that we talked about. Next, go.
All right, we got our broken forward. So on these feet here, because the toe is landing first on them, we often don't get any frog pressure on these feet. So our heels tend to shrink this way, and our frogs tend to go back up into the foot or dissipate.
You're good. So I'll jump in. So on the heel part, this Cody talked about this earlier. It's a couple things I want you guys to keep in mind. If you look on here where my ruler's coming in, there's a suspensory apparatus that comes down and hangs through here. So it's called the straight sesamoidian, and then there's an couple oblique sesamoidians, and then there's some suspensory ligaments that come down, hook onto the navicular bone. When we say suspensory, think suspend, okay? And where Code was going with this is it's kind of it seems like an oxymoron, where you would think that the suspensory on this horse wouldn't be as engaged because the toe is forward, but it actually, if you look at the biomechanics on a cadaver, whenever you change that, it actually changes all this pressure and it comes up through here and adds onto the suspensory. These horses do, right? So they can cause coffin joint soreness and a few other things. Pasture can be sore as well, but we tend to see a lot more soft tissue injuries in that upright leg, or that, if remember I was talking about the low heel being out and the tall heel being back on these babies and as they mature through life, that foot never really gets to come back because the tendon and the ligaments have already kind of set in place. Okay?
So would you say that when we have a grade 2 or a grade 3 club foot, our shoulders are at different heights and you often see different muscle growths in them?
Yeah, for sure.
Yeah.
And it's interesting because you'd think, I hope I don't say this wrong, but I always got to think about this. So it's interesting because this foot you would think would actually have the higher shoulder, but actually has the lower shoulder on it, and the low heel tends to be the shoulder jumps up. Am I getting that right?
Yep.
Yeah. Okay. That's the kind of, I have to always, sorry, sometimes I have to really look at the horse and then tell me the answer. But yeah, that's kind of been my finding as well.
For sure.
Okay.
All right. Now we move into the trim. We can see on the picture the far left, our heels are very run forward. We got a very long toe. We often call that toe, we have white line disease, or it's separated. We want that, the line. So we're going to move right into this, and hopefully you can see with this kind of a clear line. We call that the white line. And what happens when our toes start to pull forward is we often get separation, just like in here. So we don't want that toe getting too far forward on us, or we just end up getting a bacterial infection that runs right up the toe. It's very hard to get our breakover points back correctly. So, and the picture on the right of the two, you can see both our yellow and our red lines are even. We want that the toe and the heels brought back to the widest point of the frog, and that'll give us nice frog pressure. And what happens when we have nice frog pressure is that sole will actually retract, and we can end up taking more toe off as we move forward. Now, the first couple of times after we see a picture like on the left, it's hard to take more toe because we don't have the sole depth. So we got to leave that sole depth there. So, and over time, it'll eventually back up. But I get a lot of comments from, say, horse owners that, oh, my horse looks like it has long toes. It does in theory, but we have proper blood flow through the foot.
Yeah.
So as we move forward, that toe will back itself up.
Yeah.
And
And that circumflex artery is playing a big part in there, right? Like as
Yeah.
far as underneath there. Cody, can you go over a couple of things for me just to clarify? Do you think as that foot moves forward, like the one on the left that has the two different lines, one's yellow, the other one's red? Yeah. So the shorter one, which is the red one, I think, like we're trying to get back towards that, right? And then those heels almost end up like like, do you see how the one looks nice and straight and the other just almost looks like it's curling in? I'd say that's a fairly common thing to see if we're in that area, right, where those heels are almost too weak.
Yeah.
Is that how you would describe that?
Yeah, what happens when we can see our frog here. When the frog dies off, the heels tend to scrunch in, and the frog is trying to find support somewhere, but it can't find support anywhere because our pressure is all the way over into the, almost the middle of the foot.
Yeah. Okay. That's perfect. That's kind of what I'm trying to get at. If you look at those two frogs in the picture, I know they're not the same foot, but the one on the right definitely has to me, a little bit wider, nicer look to it. Whereas the one on the left tends to be a little bit more deep and it's narrower all the way through. And I look at those heels and I just don't have that nice wide support that we're looking for. And it comes back to that bony column too, that we ended up talking. You have that leg again too. If you start to relate all the things that you're trimming on the bottom, okay, so everything that's happening here, it does affect what's up here, but what's up here is affecting what's happening down there too, right? Like it's a dynamic thing, right? So we need that heel to be nice and wide at the back. We also need it to come as far underneath as we can, naturally get it, right? And sometimes we have to synthetically make it or alter it because we want this driving through that frog and that deep digital cushion that Cody was talking about before. So, okay.
So as you guys can see in the bottom right picture, it's kind of tough. Our screen's a little different, but there's a nice red line, and that red line will show you where we want the heels to be, whereas the dotted line is showing, a nice correct bony column, and ideally that's what we would like. And me and Chad preach on the daily basis, it seems like, but so
okay, next slide if we're good.
All right, as we were talking about the false or synthetic heel, this is the line that I try and shoe every horse that I can. It seems like when a horse is heel sore, he'll either have really long toes and he'll stand with his either one or both feet stretched out in front of him to try and relieve that DDFT pressure. Or if they have shorter toes and no heel, it seems like they want to try and stand more behind themselves. So theoretically, what we try and do is if we have a horse standing square, and sometimes it's super tough depending on how they're standing and how they feel, but we want our line running from the middle of the shoulder down into the middle of the cannon bone, the knee, into the middle of the cannon bone, into the middle of the fetlock. And like Chad was saying, we want that line to come right back. And when we have our heels run right forward, the only way to help that horse out is to move that shoe back. And it is a tough game because we got, this much shoe hanging out on a horse that is either running a barrel pattern or jumping. And sometimes we'll catch that shoe more often than not, but it's what the horse needs. And I'm a firm believer that we do what's right for the horse.
Yeah. You just got to alter the mechanics, right?
Yeah.
I think is the main thing, right? Just see what we can do.
And especially when we see those horses with the big long toes, they're so used to that extra pressure to try and break the foot over. When you mechanically bring the foot back underneath of itself, it takes less pressure. So both the hind and the front feet are moving faster than the horse is used to. And that's where they tend to catch more shoes.
Yeah. Okay. Next slide, you think?
All right. New topic. We'll talk about breakover. We got the long toe, low heel again. Various valgus. So we got toe in, toe out. And we'll talk about where flares come from. So we got our picture in the top left, and we've seen this one in the previous slide, but it's so important that we have those heels coming back to the widest point of the foot. And it's not so much where, we want that we have our legs standing straight up. It might look like the heels are sitting right on the ground, but when we draw our line, we want that line to be where the furthest part back of the heel is. We need that blood flow to circulate throughout the foot. And so when we go to the picture on the right, it's this is kind of more of a hind foot, but we can see that horse doesn't want to stand underneath of itself. We got the one left foot kind of wants to come back underneath, whereas the right one wants to be more forward. Now, this horse here obviously has very run forward heels, and it's hard to say what's going on. This isn't a horse that I've done, but I think, we should have a little bit more heel support on that horse to try and bring them both back underneath of himself a little more. But if we go to the hind feet, and this is, I think it's not quite out there as education wise yet. There isn't as definitive lines, if that makes sense, as the middle of the shoulder. Whereas on the bigger horses, we often see as if you can tell, the coronet band. So this is our coronet band right here, our hairline. We want that hairline to be somewhere pointing between the shoulder and the knee of the horse. Now, depending on size, our bigger horses will be a little higher up in the shoulder area, and our smaller cutting horses will be, towards the knee. But if we can mechanically bring that leg back underneath of itself and drop the coronet band, that horse now stands underneath of itself and works the upper limbs as well.
Yeah. And just to kind of bring it over onto the evidence-based, like veterinary side, there's been I know there's lots of papers published on the front foot with the negative palmar angle, like the front foot. This negative plantar angle, I'd say like 2 or 3 years ago at AEP, they were talking a lot about this negative plantar angle and the association that the incidence of lamenesses and difficulties in the hind limb goes up significantly in those horses that have that flat to negative plantar angle. Yeah, I'll get that right. So it's think your lower limb and then your hands, right? So the front feet are the hands and back feet are your fingers or your toes, right? So that palmar or plantar angle is pretty crucial. And what Cody's talking about, it just gives us a ballpark, right?
Yeah.
Like it's not guaranteed that, that angle's to whatever, but it does. We do a lot of radiographs based on just some of those quick assumptions, just to make sure that we feel like that coffin bone is in the right place and that we're not putting too much stress on the suspensory apparatus behind, as well as the hock and stifle, right? We want it to move up to where the musculature and the bone are doing their appropriate parts inside the body. Because whenever we shift that bony column, sometimes the muscle or the ligaments now take on the extra stress that they shouldn't take on, that the bone did take.
Mm-hmm. I think it's also important when our horses have the pink line that wants to point more towards the ear, say the middle of the back, those legs tend to move forward. So when we start bringing everything backwards, those muscles like the SI and stuff, it doesn't exactly, it's not as strong as the rest of the body. It hasn't been worked in a while. So when we bring that foot back underneath of itself, we tend to see some, I'm not going to say lamenesses, but sorenesses, and may take, a couple months for that horse to build the strength back up it needs to. So be expecting a different horse as the changes start to evolve.
Yeah, I'd say a lot of the shoeing stuff that you do is there's a bit of a transition period there, right?
Sure.
If they've been if their body's adjusted to improper biomechanics, and then you're trying to bring it back to proper biomechanics, you are going to have a shift in what's happening inside that body.
So talking about, it's more common in front feet when they start to get out in front of ourselves. We often see, sole bruising, all that stuff. So we're abscessing constantly as that foot is moving forward. And as we start to bring that foot back under ourselves, we're now taking the internal structures and bringing them backwards. So now we may see more abscesses or more bruising coming out in that foot as well. So
yeah. Next slide, then, you think?
All right, we got Varus and Valgus. So Varus is toed in. Now, in my shoeing practice, I'm a firm believer of the line that we showed you previously. I'm also a firm believer in heel placement. I love to see, nice even heels hitting the ground, not too far before the toe, but just slightly enough to create some blood circulation. Now, I think people may get scared if your horse is toed in or toed out, but there's no fixing it. We have to work with what we have. And so what happens when we have a toed in horse is the inside heel wants to hit the ground first. And if we can, you can't see it very well, but you'll notice the inside heel is a little more run forward than the outside heel. And the stresses will begin to pull where we call the toe quarters away from the body. And so we have our foot, when it lands, it wants to land here, but the concussion is pushing the rest of the foot further away from the body. Now, when we move to the valgus, the toed out foot, we often see lots of lateral heel pressure, and we'll see more of the inside toe move away from the body.
So because Cody and I are dealing with two different things. I mean, we're always talking about the bottom of the foot with our clients on these toed in and toed out. I think the toed in horse for me is the most difficult to manage from a soundness standpoint.
I totally agree.
Yeah, okay. It feels like if that torsion is pushing in, I get more pressure on the pastern and through the coffin joint. It seems like we have more difficulty with that. And I don't have a really good explanation because you'd think it would be the same, like toed in, toed out. But for sure, the difficulties in these toed in horses tends to be hard. Now, if they're toed out to where, they're going north and it's going east, then that's a problem, right? Like that's a real problem. But it's just I think it's the mild ones that are the hard ones for me. Like those mildly toed in, they tend to develop over time. You will be dealing with something there. If they're mildly toed out and they're shod, they tend to stay pretty sound. Am I getting too far?
I think that is correct. We could have two different. We could either have the knee that's twisting limb or the fetlock. So it's kind of a tough topic to talk about because you got a toed in or toed out horse, but you got 10 things going on at one time. So we kind of have to find a comfortable situation and continue on with it. But
I'd say the knee ones really get to be a problem after a while if they're toed, like if they're completely bowed in from the knee down. I would say the vast majority of the horses that I see are from the fetlock down. Would you say?
Yeah, for sure.
Yeah, and then but just keep in mind when you guys are buying a horse that's something that you really want to kind of look at, right? When you go to buy horses, is look at those things. We don't try to fix these problems.
No.
We try to mitigate, or work with the breakover. And this is kind of where we're going with this is like in a normal horse, with a normal HPA and a normal straight leg, we're going to have kind of a soft heel to toe. And then like Cody said, we're going to get the landing. And then we want that breakover to be as quick as it can be. These horses, obviously, like he said, you're going to see a land here, or I'm going to land here, and then I'm going to turn over like this, or I'm going to turn over like that. And I think that's a big part of just the balance on them and getting the support and the breakover, and not trying to correct this and make it do this, just being like, okay, well, it's landing here, it's landing here. I got to work with that. It's going to break over here, so I need to break over with it. I think when you start putting the steel in the way, it starts to hurt these legs even more.
Yeah. Okay. I'm a firm believer of slow motion videos. So sometimes it'll take me, a couple of times to get the shoe correctly, but at least we have a slow-mo and, you're not trying to watch this horse walk at 50 mile an hour.
Yep.
We can, take that foot and put it into milliseconds. And that way, we can get things correct before we send the horse away and things get worse or better.
Perfect. Okay. Next slide.
All right, flares. So we talked about, the uneven heel landings. And if we can see on the picture on the left, judging by how straight up and down the left red arrow is and how much flare is on the inside of that foot, we can tell that foot is landing laterally and pushing the inside of that foot out. And we can see a stress crack as well happening just in front of that red line. Now, when we get those stress cracks, we often see white line disease. So those cracks happen more easily because we have such a hoof wall that is already manipulated. It's important, and I think once we have flares, the only way to get rid of flares is to take them off. So, you know, I'm a believer of, if you want it gone, get it gone, or if you want heel, put the shoe where you want it to be. So
yeah, and to Cody, what Cody's saying, I mean, it's all in the horseshoer's choice of how you're going to kind of run through those. You know, most of the athletic horses that we're dealing with, we're trying to get those horses into a competition shape or into where they need to be. And so I think those are a big part of it, is trying to figure that out. Do keep in mind that, and as Cody just mentioned, depending on your trim and where you're at, there is some adjustment because it's a pretty plastic capsule as well, right? Like you said, it's pretty plastic. But I find that if I have a horse that flares, it's going to flare. Like it just seems like it's almost like it's, I don't want to say the word genetic, but they've been doing it for a long time. And it's one of those things where you just kind of keep it trimmed off. And those horses oftentimes need some shoe. There is some flare that can be fixed, right, as far as the different things that you do through their upper body or how they stand to try and do that. But it's a management situation, I think, for the most part.
Yeah,
you say.
I think a poor foot genetic will transfer down many generations, and you know, you can always tell a thoroughbred horse from a regular bred horse or a quarter horse, that thoroughbred foot, and it seems like they're more malleable and they move a little easier than, you know, our older quarter horse style horses. So
what do we have on uneven and cracks? So you talked a little bit about cracks. I think we don't want to, we're trying to keep our topic pretty focused. So cracks can be a multiple of things. I think a lot of times we look at them as they can be, you know, that there's something wrong with the coronary band, but a lot of times it comes in for uneven pressure. And I think that's why we brought it in. I know that's why we put it in this topic to not get off on, you know, all the potential cracks that could happen. But in general, I mean, it's almost like, I remember there's a guy out there, he's got a little age on him, but I really like him. His name's Art Goulet. And so back in the day, when I was a baby veterinarian, Art took a styrofoam cup and he showed me, and he said, like, if you press too hard on the inside of that styrofoam, because you think the crack's going to be on the opposite side, but he said it's usually the load, and it's like that styrofoam, and it collapses, right? And then you end up with that crack, and that stuck with me for 26 years or whatever. So I think that's part of why we wanted to go over that a little bit in the unevenness and the malalignment, right?
Yeah, that just brings us back to the point of how that heel placement and evenness of the heel placement when it hits the ground is so important. You know, that way we don't have a shift in the foot and, you know, internal structures as well.
Okay, next slide then, I think.
All right.
Look at that.
Well, we talked about how important the HPA was. You know, I think in today's generation, you know, there's so much information out there that it's more important to educate our horse owners rather than, you know, chatterite to try and talk to every horseshoer. I think there's 1,000 ways to shoe a horse, but there's only one bony column of a horse, right? And how it should be. So that
was the goal of today's talk when Cody and I sat down. There's so many ways to shoe.
So,
and you got your heel support, no matter what you're doing for shoeing. I mean, this just comes back to if you just, I mean, a lot of horses are managed in our practice as barefoot. Like, you can use the term barefoot trim, but pretty much everybody's barefoot trimming. They're just putting a shoe on, right? Because I think that's one of the things we want to talk about today is this HPA is, you can manipulate it with shoes and different things, but in general, some of it's set in place from the time when they're little, before we get a chance to really get a chance, you know, hold them while they're developing. Some of it's created though, and being able to trim appropriately, have that heel support, and working with the breakover is a big part of it as well. We didn't particularly on purpose get in any to show any shoes at all today. Cody does some hot shoeing. He does some keg shoeing. I think that's one of the things we've been trying to play with is like, I don't know that you need a specific kind of horse shoer. You just need somebody that's going to work with that HPA and work with a good, healthy foot and be able to, help you with these three categories and whatever that gadget is, right? Like if it's a egg bar, if it's a pad, if it's a regular shoe, if it's a barefoot, I think we can get to a point where this HPA heel support and breakover can be maximized, right? I guess that's the best way to say it.
Yeah. At the end of the day, it doesn't matter what the foot looks like as long as the body's functional.
Yeah, exactly. And then you get that body support too that we talked about up through the top, right? Where these horses are standing with the appropriate posture. And then when they're using themselves biomechanically, they just move a little bit better. So we did that pretty good. I thought you were going to talk way too much, Cody, but you didn't.
Not me.
No, not at all. Okay. Thanks, Wheezy.
We got a couple questions. I don't know if you've covered them. I was just on the phone with another one of our vets. So if you've already answered these, just let me know. But EQ, I'm going to butcher this, EQ Equor Solutions, sorry. How frequent do you find medial lateral imbalance when assessing capsule lameness in conjunction with the stifles in particular?
I believe in like all my hind feet that I've had to bring back. I believe there is some sort of stifle lameness in there. Now, it's tough because, right now we're in a downturn in the economy. So either they hire me or they hire Chad, it seems like. So we can't always work together on these cases. But I believe there is some sort of stifle lameness in every case like that.
Yeah. So I think so just to come back to a couple of things, if we go like Cody's talking, if you're looking medial and lateral, I find if it's a primary like medial femoral condyle type of thing, or classic lameness where the medial patellar ligament or the medial meniscus is involved, I find those horses want to land a little wider. And so in general, okay, I don't want to try and get too ruly here, but in general, that foot is going out. And now I find these horses are down and I get a little bit of flare to those horses if we're not careful. They'll get that whether they're shod or, if they're shod, it's a lot harder to see. Mm-hmm. If they're not shod, you'll definitely see that. As far as if we're talking about the plantar angle, if it's negative, I'm trying to go across the foot from the outside and I'm trying to go across the foot from the front to the back. Okay. So if I have a negative plantar angle, definitely, I think our slant on that is that the stifle is adjusting. I probably see, I'm kind of guessing here, and I'm not trying to be too waffly, but it's more SI stuff than I would say stifle for me, if that plantar angle is negative.
Okay. Somebody asked, for horses that are shod all year round, do you see more issues with contracted heels?
I'm not a believer in that. I think if a horse is shod correctly and you have proper blood flow, I don't believe that foot has the opportunity to contract.
Yeah, I agree with Cody a whole bunch. I do think that, we try to take into account sometimes the heat from the hot shoeing can change things, so I think that question might be driving at that a little bit. Heat may affect those feet. I don't know that I could tell you the percentage. And I think we would all agree that if the horse is in a spot where it could be turned out for a bit and not have shoes on, and it doesn't break the foot up or cause grief, I think everybody would be okay with a shoe coming off if there's for a certain season or two through the winter or through seasons when the horses aren't being used as much, or even if you are roping on them in the wintertime, being able to maybe have the shoe off for a little bit so that foot adjusts to the different dynamics that happen without the shoe on. I don't think that's a negative thing.
No, I think it's a kind of a case by case scenario.
Yeah.
If we have say if we have a navicular horse, obviously that style of horse can't come out of a shoe. We have to, work the best we can to try and keep those heels expanding and keep that concussion correctly. But that's a tough one. There's a lot, it could go a lot of different ways.
That's a very loaded question, to be honest with you. And you do see some horses that the shoeing may contract the feet, right?
Yeah.
And I think that's a created thing. I don't think that's to do with the shoeing. I think we're creating that through the human.
And, depending on the season we're in, our spring times tend to be a lot wetter. So us as farriers tend to put everything a little bit tighter. And now we're jeopardizing the foot in a different way as well. So we kind of got to work with the horse owners on this as well.
Okay. I think Abby asked this question. There seemed to be a little technology fail, but somebody said, when working with forward run toes, what kind of farrier schedule should you stick to and for how long?
That's also another topic that I guess could depend on how the foot reacts to the changes that are happening. I've had horses that toes tend to collect within 2 or 3 cycles, but I've also had toes where it takes a full year to kind of get things back underneath of themselves. So.
E-Cure, they help me out with their pronunciation. How much damage can a poorly fit shoe cause?
A lot.
Thanks for saying that.
Again, I think that's the whole reason we did this topic is, to educate our horse owners. But, we find that farriers tend to end on the safe side and put too small of shoes on. And that's when we tend to see those heels and those toes run more forward. And, then we're starting to get into the sore heels and navicular, sometimes we'll see a torn DDFT.
Yeah. And I think this comes back to, we all become comfortable with things that work for us. Does that make sense? And so sometimes it's hard to move to a new technique, or a new way of doing things. So sometimes we'll put, I think we have to just ask ourselves these questions, like, is just doing it the same over and over the right thing, or does this horse need something different than what I'm doing? And I think, we go through this all the time. Like, if I treat a horse and it's not better, there's 2 questions, right?
Mm-hmm.
First of all, am I in the right place, right? Like, honestly, right? Like, if you injected the hocks and the horse isn't any better, you're like, am I in the right place? And then the second question that isn't the big question for me is, if I'm in the right place, did I choose the right treatment? And I think that's where we come back to the shoeing thing is like, okay, if I've got this particular thing going on, and just because the gadget that comes out of the boxer is the easiest for me to put on, is that the right thing for this horse? Well, maybe that's what I know best, so I try it first. But if that's not working, then I think we have to step back and be like, hey, I need to talk to somebody else, or ask some questions, or get some radiographs and kind of look at it. I think that's where we end up with the shoes sometimes that they're nice shoes and they're put on well, but they're maybe not the right shoe for that horse.
Me personally, I'll tend to, maybe start out at the cheapest method. And if that ain't working, progressively get to the more expensive methods. And I think, if we try the most expensive method and that works, we tend to scare horse owners away sometimes. Maybe instead of, getting a horse sound, it's sound, but they can't afford to shoe that horse every 4 to 6 weeks to create that problem. So now we're scaring our horse owners away from us.
And was cycle in there too? Is part of this cycle as well, like how long between shootings, or is it just the kind of shoes? Which was it, Wheezy?
Oh yeah, they just said how much damage can a poorly fit shoe cause. Yeah.
So cycle is different question. Okay.
Right. All right. Well, that appears to be the end of the questions. So big thanks to Dr. Chad Hewlett and Cody Calhoun of Smokin Equine for coming to finish off our talk today. In the future, so next month, this is the second of 3 talks that we're going to be doing. At the end of March, Dr. Chad Hewlett will be back, but this time with Dr. Travis Kelter, and we will be talking about myths, realities, and all sorts of other things about joint injections. So Dr. Travis Kelter is going to focus on prophylactic joint support, such as your Legends, your Pentazan, and some supplementation that you can do orally. Whereas Dr. Chad Hewlett's going to focus more on corticosteroid injections, as well as injections such as regenerative therapies like IRAP or PRP. So we're going to talk all about that big buzzword, joint injections, at the end of March, and that'll wrap up our sports therapy lecture series for 2021. Thanks to everyone for joining us. If you want to watch this back, it'll be up on YouTube next week. And again, big thanks to Katie Imler of Cody Equine and Kody for joining us and hanging out with our team and making some really great PowerPoints, because I can promise you the vets didn't do them. So shout out to them, and we will hopefully see you guys soon on Zoom at the end of next month. Thanks, Kody. Thanks, Chad.
Thank you.
See you.